Good afternoon, everybody, and welcome to our webinar. My name's Karen Bowness. I'm the Marketing Manager here at Medtech, and I'll be your webinar moderator today. Hopefully everyone can see my screen. So today's session is the third in our practice growth series. The first one, I know many of you joined us, was just an overview on practice growth and the various concepts available to you to adopt in order to grow your practice. And then, as we promised, with the second one, we took a deep dive into one of those concepts, which was attracting new patients using practice marketing. That was our last one, and we got some great feedback from that one. Today's session, we're looking at growth strategy number 2, which is improving practice efficiency with systems, policies and procedures. So to help us cover all of that important content, I've got some great speakers with us today. Firstly, Ben LeGros from Medtech. Hi, Ben.
Hi, Karen.
And also Russell Lee from Health Business Network and Stephen Makarunas from the Private Practice. Hi, Stephen and Russell.
Hi, everyone.
Hi, everyone.
Thanks for your time today, guys. We've got so much to cover that I'm going to get going with our agenda. As usual, we'll have our housekeeping, which we're halfway through. Then I'm going to pass over to Ben, who's going to talk to you about how you can harness technology to increase efficiency in your practice. Ben's an expert on that. He's been helping companies to use practice management systems and software to increase efficiency in their practice for many years. Then he's going to hand over to Russell and Stephen, who are going to share with us the right systems, policies and procedures for practice efficiencies. And then at the end, we've got some time allocated for questions and answers. But as always, I invite you to ask questions throughout the session. And I will try and answer those because that's my job as webinar moderator. And any that I can't answer, I will keep to the end and ask one of our presenters. In order for you to get the best out of today's session, though, I would like to show you how to use GoToWebinar, which hopefully you have on your screen somewhere, a control panel that looks a little bit like this. It normally sits in the right-hand side of the screen, but if yours seems to be floating or moved to somewhere else, you can actually click on it and drag it to the corner. You can also minimize the control panel by clicking on the orange arrow, which works as a toggle. If you click on it, it will minimize the control panel. Click on it again, it will maximize it. The option underneath is the mute button, which you'll notice everybody in the call's mute because we have too many people on the call for everyone to chat. The option underneath is a window which allows you to minimize or maximize the background window. So I suggest we have some quite busy slides today. So you might want to increase the size by clicking on that of your background window to make sure you're in full screen. Again, it works like a toggle. So just to turn it on or off, you just click on it. And the next one, which I think we'll be using today, is hand raising. So that just allows us to gauge the number of people that are answering a certain question. So if everyone can click on that for me to show me that your hand raising is working, that would be wonderful. Yeah, I've got a couple of hands raised. Perfect. Thanks, everyone, for that. And then the most important option for us today is showing you how to ask a question. So all you need to do is simply put your question here and press send, and I'll be here on the other end ready to answer them or make a note of it to ask our presenters later. So if you're having any problems with using GoToWebinar, please also send me a message through GoToWebinar and I'll answer that straight away. Now, I'm really pleased to hand over to Ben LeGros, our National Sales Manager here in Australia, who's going to talk to you about how you can increase efficiency using technology in your practice. So over to you, Ben.
Thanks for that, Karen. Thank you, everyone, for attending. Today, we're going to go through harnessing technology in the practice. I visit a lot of practices throughout the year, 2 to 3 a day in some cases, and I find a lot of practices use different technology, some using it widely, some using it very, very simply. Now, I want to give you some advantages that we have in our software that you can take potential of either as a full suite or in their own segment. We offer the complete solution here at MedTech. We offer everything from a standard practice management system through to patient recalls, reminders, online appointments, a patient portal where they can view lab results, repeat prescriptions, and share their patient records with other providers, and also take it with them when they travel. Remote health monitoring, which lets them send their vitals via blood pressure, scales, O2 monitors, all those kind of devices. Even a Fitbit or Apple Watch can be plugged into our software. And then a telehealth consult system where you can actually consult with your patients either in a rural environment or even in a metro environment where the patient doesn't have the time to come into the practice but can have a consultation with you for mental health or any other type of consultation you want to do. So today's kind of automatic workflow that I'm going to talk about is just the standard things that make the practice run more efficiently. First thing we're going to talk about is online appointments. Online appointments have been around for a while now, but we find a lot of practices still are not taking benefit of it. It does help the practice in so many ways. Like it says here, 24/7 ability for patients to make bookings. You're closed does not mean your patients can't make bookings. We're in a generation now where everyone has a smartphone. Everyone wants things quicker, faster, more efficient. Using online appointments is beneficial to the practice. Having this embedded in your website, built into your own website, when you Google search your practice, making the ability for your patients to pick you as a practitioner, pick you as a practice, and just select their appointments with less fuss and less burden on the admin team and reception team makes a hell of a lot of difference. I've been into practices where I've gone to visit them and I'm standing there for at least 10 to 15 minutes because front desk are totally under the pump. They're taking phone calls, they are getting the billings done, and they've got people coming in to check in. Online appointments can make it a lot easier for a patient to make an appointment, alleviating the phone calls in the practice, giving more time for the front desk people to manage the people that are there and also manage the people that are leaving the practice at the time. The next one, telehealth assessments. A lot of the practices I talk to at the moment like to do a pre-assessment prior to their consultation. Now, this seems like a new thing at the moment. A lot of treatments around cannabis seem to be doing this kind of feature, where they are sitting down with the patient using a basic template to do a consultation with the patient either over the phone or via telehealth. If you want to do a telehealth consult or over the phone consult with your patient, you don't want to be sitting there typing notes manually. You want to have the ability to do a quick patient consult using question-based outcomes and yes/no answers. This gives you the ability to have more of a relationship with the patient when they're in front of you. It makes it also easier and more effective while you're selecting these options to give you actual dynamic outcomes. We do a lot of these forms in MedTech Evolution where we can do diabetes risk assessment, where it takes calculations from your weight, blood sugar levels, and other information and gives you an actual calculated based outcome. Same thing with the form you see on screen. As I'm selecting the options, the form is dynamically changing and giving me more options and then giving me an actual outcome and saving it to my patient record as part of my consultation. The next one, automated reminders. I've done my pre-assessment. The doctor's told me I think I better come in for a consultation. Or I've had my online appointment and I want my reminder to come to my mobile phone. It can come in via SMS. It can come in via a patient management portal. As you can see on the screen, I've got it via SMS at the moment. I haven't had to push a button through the PMS system or anything. It's automatically sent me the message saying when my appointment is, what time it is, which doctor, and what medical clinic. The next feature of this system is that I can reply to it. I can take that message, say, yes, I will be there at 1:26. Or no, sorry, I'm unavailable or running late. That feature then goes straight through into the PMS system, giving the practice knowledge of what you've actually messaged back. So then it doesn't stop no-shows, but it alleviates the amount of no-shows you have in the practice, making time more efficiently used by the doctor in the practice. The next one, the patient is checked in now. They've come into the practice. They see front desk is busy, like I said before. The girls at front desk are on the phone. They don't want to line up. They don't want to stand there. They're not feeling that great. They just want to sit down and wait to see the doctor. The simplest way to do that is use something like a kiosk. Our kiosk system integrates with our software where they can check straight in and actually update their details, answer questions, and also check other members of their family in. If they have a child with them, they can check them in. And they can also check in for multiple appointments, giving the ability for, again, front desk and the girls at reception or guys at reception to be able to do their other duties. Sometimes when I talk to practices, they think a kiosk is going to replace one of their front desk girls or guys. It's not. It's alleviating the burden that's on them, giving them the ability to either chase up recalls, call up patients about their appointments, do the billing, all those kind of things. I have never seen a kiosk replace a person in a practice. All it's done is make the practice run more efficient. The next one, digital data. Again, like I was talking about in the telehealth assessment or additional assessment before consultation, you can use those same forms as part of your consultation. I've been into many practices as a patient where I've sat down in front of the doctor and said, I'm not feeling that great. And I've sat down in the chair beside his desk. He does his examination of me, and the next 2 to 3 minutes, he's sitting there typing in front of the screen. He's not looking at me or relating to me at the time, but wouldn't it be better if he could have a tablet in front of him where he's just going through question-based answers and putting in information at a much basic level and providing outcomes, making it easier for him, making it easier for you, and having more of a relationship with your doctor and discussing your actual issues. You will feel a lot better, and so will the doctor when they've actually got that kind of rapport between you and the patient. A lot of my practices that use our software use these forms in so many different things. Diabetes risk assessment, tuberculosis management, care plans. I've seen a doctor that's built one of these to manage all his diabetes care plans. All practice management systems have care plan systems, but he's actually designed his own using this form system and simplified the solution right down to the fine-tuned questions that he wants to ask and get answered. Another feature of these forms is that they are reportable. So they are actual data sets within the system. So when you type them in, they can go into their screening terms. They can go into their inbox and outbox documents. They can go into their actual patient record. You can even use it to do prescriptions. It can link with the prescription database. And you can also print it out and give it to the patient as well. So you can do patient handouts, consultation notes, prescriptions. It's really up to what the brain can think on what you can actually do with something like this within the practice. I've had practices draw these on a notepad, a piece of paper, and scan them to me and say, can you do this? And my development team have developed it and given it to them, and they were amazed how easy it was from just the thought in their head straight onto a digital system. So what we've spoken about so far are the 5 major things that we've done so far as online appointments, telehealth assessments, automated reminders, kiosk check-in, and digital forms. Taking that form into clinical outcomes, like I just discussed, would streamline your efficiencies a lot more and give you other customized windows within our software. Our software is not locked into a standard workflow like some PMS systems. It gives you the ability to adapt depending on what you want to do within the practice. I don't want to tell you how to do your job. You tell us how you want to do your job, and we work with you with our software team and our design team to build your workflow. The patient is now being seen in the consult. You've done the advanced form or patient consultation. You've provided a great outcome for the patient. Now you want to bill them. Why can't billing be totally seamless? Why can't you use something like a Tyro integrated system, which plugs straight into EasyClaim, gives the patient the ability to get their Medicare rebate straight back into their bank account? Also, have the ability to do private health funds. Don't need a HiCaps device. Have Tyro do both systems, both Medicare and private health funds using our HealthPoint on Tyro. We also have the feature of EPC tracking. For some of you, extended primary care plan tracking is quite important. You can actually know when a patient has come for their EPC plans and how many they have left. And it can be tracked. If they go to a different practice and use one of those care plan arrangements, it will then notify you when they come in for their next. That saves a lot of time and money, and it's another efficiency that a practice should be aware of. Now, the patient's left. They've made payment, they've got their Medicare funds back in their account. How do you follow up with the patient? Again, front desk, you're getting enough calls throughout the day. Why can't you automate the patient recalls through a patient portal? Give the patients the ability to actually send information about their online repeats. They might need a repeat prescription. They can use our online portal that plugs straight into the PMS to actually order those. Lab results. If a patient's lab results come back clear and you just want to notify them without having to call them up, having to keep calling them up until they answer, everyone's busy these days. There's not enough time in the day, I find. You can send them their lab results to the patient portal. Let them have full access to it. See those results. And then also, if they're overseas and they've just had a blood test and they're feeling really sick and they might go into a pharmacy or see a doctor, they can actually give access to that doctor while they're being treated of lab results they've just had. Same with their prescriptions. You're carrying around your data now in your pocket in a secure system that gives you the ability in a country that might not really speak English as a first language. You can show them the information and they pretty much might understand it. And the last one, again, video consulting. You have a patient that's on a chronic disease management plan and they can't come into the clinic. They're not available or they're too far away. Do a follow-up telehealth consult with the patient. Discuss with them the outcomes or how they feel over the video consultation system. We do a lot of mental health psychology practices where video consults are totally beneficial with the patient. They can call up and actually say, hey, I'm not feeling good today, being the Are You Okay day today at the moment, which is a good kind of inlet. And have those consultations with the patient. Put it into your calendars. Use video consultation as a standard consult throughout the day. I was in a practice a few weeks back where they do the first consultation initially on site and the rest of them are all done by video. And they can speak with their customers whenever the patients are available and whenever the doctors are available. It's streamlining and making it more effective within the practice and outside the practice is what you really need to do today. We've got so many patients that you look after. It's very hard to look after them all inside the practice and outside of the practice at the same time. But with our kind of software that MedTech offers as a full suite solution or using just partial parts of our solution, you can have the benefits of all these features and provide really good outcomes for your patient and make your practice a hell of a lot more efficient. Now, from pretty much what I've told you in my slide deck, if you have any other questions or would like to see any more information about this, we will be providing you with a survey at the end. and we can organize a remote demo or on-site demo with my sales guys to show you some of these features that I've shown, and even go through the full workflow that I've shown in a more detailed state and show you how you can use either some of those efficiencies or the full suite inside your practice to make it more efficient. I hope my presentation has been helpful for you. And if you have any further questions, feel free to ask them after the webinar, and we'll try to answer them as soon as we can. Thank you. And I'll hand it back over to Karen now to take over to go through Russell and Steve.
Thanks for that, Ben. I'm pleased to welcome Russell Lee and Stephen Makarunas, our practice growth and today efficiency experts. So thank you, Russell and Stephen. I'll hand over to you.
Thanks very much, Karen, and thank you, Ben, and thanks to all that are listening and viewing our presentation. It's a great pleasure to be partnering with you again, MedTech team, to deliver insights and strategies around practice growth for our participants. I want to start, if I may, by giving you a quote from I think one of the finest minds around business commentary in the world, and that is Michael Gerber. Many of you may have heard of Michael Gerber and his quite famous book, The E-Myth, E standing for entrepreneur. And he suggests that at the helm of every successful business must be an entrepreneur. And don't be scared by that. He's not necessarily suggesting you need to be a Richard Branson or, dare I say, a Donald Trump, but you need to have a vision. And the delivery of your business and the services that it provides to your stakeholders, being the healthcare consumers, needs to be, if it's going to be truly successful, driven by vision. And Russell will tease that out in a moment. And before I introduce Russell, I just want to read this quote out to you. Gerber says this of systems. He says that money, happiness, life, they all come down to how well your practice works, not how well you work. Whether money takes the form of income, profit, cash flow, or equity, the amount of it and how much of it stays with you will always depend on how well your practice works, not on your people, not on you, but on the system. So with that in mind, I want to now introduce you to Russell Lee. Now, Russell, in my opinion, is the preeminent commentator, consultant, mentor around all things medical business management in Australia. Russell will talk a little bit about his history and his experience, but he's definitely going to impart now his wisdom around the importance of systems and how they underpin any true medical business, and particularly underpin any strategies for growth. Russell, over to you.
Thanks, Stephen. Thanks for the introduction. And Ben, it was really good to listen to your presentation and learn more about what MedTech offers and a lot of the integrated systems that are within that. And I applaud that. And I'm going to share not only about how systems, policies, and procedures can help you run the quality of practice that you want and get the outcomes that you want, but I'm also going to share some of the other digital integrated systems that you can add along with the ones that Ben has shared with you that will also help streamline your practice and get you the outcomes that you want. So I suppose the thing that I want to do is just first of all tease out your vision. What is it that you're wanting to achieve? And when I first, my background is I'm actually a cardiac intensive care nurse, and I ran and set up the first private heart surgery unit in Australia. And I had a GP friend, and he worked in a little cottage and had a great following. But one of the things that I learned very quickly is that we as two families would often go away on weekend holidays, and not long after we'd gone away, his pager would go off and he would end up back at the practice dealing with the issue. And look, the big thing that I learned was that most doctors, most practitioners have very poor time management and very poor quality of life, because all they're doing is working within their practice. And so after 10 years of talking to him, and talking about maybe it would be better to go into a multi-doctor practice where the burden could be shared, and spending weekends developing our vision of what a really good practice would look like, we went out and we actually established our own practice. And I'm going to talk a bit more about that, but I'd actually like you to, get on to your keyboard and maybe just share some of the thoughts that you actually have about what's your vision, and do you have one? Because the big thing that I found with most owners or most managers of businesses is that they really can't clearly define what their vision is. What is it that's different, that they're going to do differently to, the practice down the road?
Can I just add, I absolutely agree with you, Russell. Over the 30-odd years that I've been working with doctors around these issues, most simply fall into this notion that there's a greater demand for my services than supply of them. So all I need to do is front up and see patients. And yes, that is one measure of success, that you've got a waiting room full of people. But is that really satisfying why you got into medicine? Are you really providing the best possible services? Have you asked the question, what are the unmet needs and demands? And more importantly, have you asked the question of yourself, what do I want to get out of this? What does my life look like? Is this the life that I had envisaged? Am I meeting all of my needs, my desires? Am I fulfilling my passions? And without a vision, I think it's very difficult to do that.
So look, I'm going to move on, but I think really, really important to define this vision. And again, I'm just going to move to the next slide, because I find that oftentimes looking at quotes or looking at thesauruses and dictionaries about what some terminology means is really, really helpful. And I think these two quotes have really inspired me through my journey in owning and operating practices. And the first one is, vision is the art of seeing what is invisible to others. All right. And I've got a friend that is just amazing at helping share vision. And I describe, when you're sitting with this person, it's like a three-dimensional color picture coming at you verbally. But you actually, through how she expresses herself, is able to truly understand, what she's wanting to accomplish. The next question, I think, really takes the vision and shows what we need to do with it. And that vision must be followed by venture. It's not just good enough to look up the stairs, but we've actually got to start climbing up the stairs. And I think that, oftentimes we have what we want to do, but how much action do we put in place to make it happen? And look, I think that, all of us have seen practices that look terrible, that are really old, the carpet's worn out, there's 1956 National Geographics on the waiting room table. Or is that what you would picture? Or something really nice and modern and fresh and welcoming to be at, like I've got on the screen? I actually, when I first started, I got a big whiteboard out, and I wrote down all the things I didn't want in my practice, right? Because the opposite of that was what I really wanted. And it helped me define my vision by working out how I was going to change that negative that I didn't like. And look, I just want to share with you a little bit about my vision and where it started. And it actually started, I was in a hospital setting, and as I said to you, my business partner and I, we spent 6 months defining our dream. And eventually this was the practice that we bought. It was 1,000 square meters in a really good suburb in Sydney. That 1,000 square meters was split over 3 floors. And look, the only problem was that it only had 3 doctors in it. But our goal was to change that and grow it so that it had maybe 12, maybe 15 or 16 doctors. We had a vision that on the middle floor we'd put a health club in it and we'd do preventative and rehabilitative medicine. We wanted to have a pharmacy. We wanted to have a pathology collection. We wanted physiotherapy. We wanted allied health, so we had a dietitian on site, all the different things, so it was a one-stop shop where people could come to. And we found that in this place in Mossman, and we started. And let me tell you, it was challenging because with 3 doctors, it didn't cover the cost of the rental or all the other expenses in running it. And so we really had to develop a clear vision, a business plan, and a budget, and then grow that business. And look, it was interesting at the time. I had a 15-year-old daughter who, Rebecca, who's now 39, and Rebecca wanted to earn some money so that she could buy a car when she was old enough to get a license. And I said, all right, you're going to be my guinea pig, and I'm going to use you as my pilot to work on my policies and procedures. And I just want to ask the question, does anybody know what the most successful business in the world is that's run by 15-year-olds? Can we see someone typing furiously? Karen, are you seeing anything there? Is anybody coming up with an answer to that question?
Yes,
Everyone
we have
said
a few
McDonald's.
quick people. Yeah, McDonald's.
Very good.
Yeah.
All right, you're exactly right. McDonald's. Now, I'm not suggesting that McDonald's is the highest quality of food that's out there, but one of the things that's really, really incredible is that no matter where you go in the world, there's a consistency about the service that they do, and predominantly the staff are between the ages of 15 and 17 or 18. Right? And I felt that if I could develop systems, policies and procedures that a 15-year-old could implement, it wouldn't matter whether I had a 15, a 20-year-old, a 25 or a 30-year-old, everybody should be able to do it. So Rebecca became my guinea pig in implementing and developing those systems. The interesting thing also was, from my past experience in the hospital, is that most systems and policies and procedures are put into a big folder, all right? And, oftentimes they're quite big, but when you walk into a business and ask where they are, someone goes into a back room, pulls out the folder, and it's covered in dust, and sadly, very few people use it. All right. What we did to start with was we said, all right, we don't want that to happen. We want our systems, policies and procedures to be like our Bible that we use on a regular basis and use every day to help us with what we do. So we actually digitalized, all right, our policies and procedures. We put as an icon on the desktop so that every workstation had that, and we were able to implement and have people using it.
And it became part of the daily process of how we work here.
Yeah. So it wasn't a book or a folder that was in the back room. It was something that if somebody didn't know something, they would go to that, hopefully, before they would ask someone. And look, over time, that was the culture that we were developing. All right. So I think it's really, really important. Now, over a period of 7 years, we were able to, with those policies and procedures and systems, grow this from a 3-doctor practice to a 30-doctor practice with 8 to 10 allied health people, a pharmacy, a dentist, pathology, radiology, all the things that we talked about. And in fact, we had 17 other clinics around the country. And so all I can say is that if you are able to define your vision, if you are able to put in a simple, readable format how it's going to function on a day-to-day basis, right, and get people to use it, you are far more likely to succeed. And look, even down to the fact that I have a script for how the phone is answered, right? I have a script for how people are greeted when they come into the practice. Really, really simple things, but if you want continuity, when you order a hamburger at McDonald's, what do they say?
You want fries with that?
Fries with that. All right. So we really want to have a similar type of expectation in what we're doing. Now, I just want to go through, I'm not going to give you systems, all right? I just want to go through some of the reasons for it and why to do it. Creating systems forces you to think through the process and improve it, all right? When I put up on my board, when I put up on my whiteboard, one of the first things I put up was that I didn't want dragon ladies, all right? Now, I'm being politically incorrect here, but I didn't want receptionists who weren't happy to be in the practice, who the moment that someone walked in the door would frown at them. I wanted to have people who genuinely wanted to care for people and to share and to help them. So I started to think through that whole process of how, the type of person we wanted to employ and what we had to do to attract those type of people, what we had to do to train them. And so we thought through the forces and the processes, and then we documented how we're going to do it. A good system allows you to easily develop and integrate it. So by putting all those things in place, the time I spent with HR was reduced because I had a system of how to introduce people into the practice, how to train them, and what we were going to do with them. So that comes to the next point. It's quicker and more consistent if we have these things to bring new staff, partners, and practitioners into the practice. A good system allows you to develop and integrate new ideas. Do you know, nearly every business that I go to that's having problems, when I go into the business, someone in the business knows how to fix the problem. They just haven't been empowered or asked to. And if we create an atmosphere where we actually are encouraging people to come up with ideas, it's just amazing how receptionists, nurses, doctors will come up with solutions and new ideas that you can brainstorm and make things work. The other thing that I think, and it's probably the big reason why I got into medical practice, was systems allow principals or managers more time for practice development as well as more time off. I'd actually set up a charity taking doctors and nurses all over the world to do heart surgery on children that were born with holes in their heart. And I actually needed to have a job that would work so successfully that it would make money when I wasn't there. So my whole idea of going into medical practice with my business partner was to grow a big enough business that worked efficiently and well without me being there. So
despite you and thrive despite you, not just because of you. And that's the goal, isn't it, in any business?
Yeah. So look, one of the things that I see doctors, nurses, receptionists that are working in practice, oftentimes they are so busy because they haven't thought through and put things like this in place. Having your systems also will increase the value of your practice. And look, the whole idea of being in business is actually to have a saleable asset at some stage. And if you're not building value in your business, then you're really, not achieving too much. So one of the other things that I think that come along with good policies and procedures is it's an effective risk management strategy, and it also helps us comply with accreditation, legislation, different codes of practice, right? And that we're able to really develop a positive culture. So I'm just going to be really quick in these next slides, because really no systems, you've got no control. No control, you've got increased risk. Good control, better accountability, and better accountability, consistent performance. Consistent performance, decreased risk. Increased practice viability, improved reputation. And isn't that the type of practice that we want to own, that we want to be part of? And to me, yes, there's a lot of work in developing that, but you can't develop any of it unless you have a vision of what it's going to look like. Now, the next part of my presentation is I want to be able to show you some tools that are going to help you along the way with that. And look, one of the hardest things, remember I talked about it at the start, was taking that policy and procedure manual from a dusty cupboard out the back and having it a usable, evolving document that as we grew, as technology came along and changed, it was something that would help us. And we put it on the desktop. Now, there's a new product called Practice Hub from Avant that actually puts your policies and procedures, templates, training, compliance, integrated registers, secure document management, task manager, puts it into a cloud and allows every staff member to have access. It sends you reminders when you're supposed to be doing something and you haven't done it. It has a dashboard that allows you to see whether staff are doing it and on top of what they're doing. So it's not about policing it, but about helping you manage it in a more effective way. One of the things that I found when I was a practice manager was that I spent so much time in HR issues. I spent so much time in management that I had very little time to grow the practice, to grow what was really important, and that was the revenue, the number of patients we saw and what they were worth. And so the more I could integrate and put into products like this, that gave me back more time to grow the business. So I highly recommend you look at a product like this. It will also, by putting your policy and procedure into it, it will make you review it and see whether it's current, whether it's viable and what you need to be doing today. The 5 pillars for me of success are the way we think, the way we feel, how flexible we are, whether we have rapport with people, and how good we are at our day-to-day operations. And look, when I came out of the hospital setting into general practice, it really was a cottage industry. And look, if I asked a person what a patient was worth, what it cost to get that patient, what it cost to provide for that patient, most people couldn't tell me. But I realised from what I'd learned in setting up the hospital, the cardiac surgery program that I had, that I needed to know all those things. And so the next points to me were given to me when I first started, and that was the SMART metrics. Be specific about everything you do. Make everything measurable. Have an action-orientated plan. Be realistic about that plan and make sure that you've got a time or a date that things are going to be accomplished by. Without that, you're really not going to get too far. And so to me, the metrics of owning and operating a business are really, really important. When I first started, at the end of the shift, if I wasn't there at the end of the day, I wanted my daughter, who was one of the receptionists or someone, to text me and tell me how many patients we'd seen. Because I knew that once we got to this number of patients a day, I was actually going to be breaking even. And when I knew that I got to this number of patients a day, I was making a profit. So what are some of the things that we can do? And we call them KPIs, or key performance indicators. And I think it's really important. I talked about the number of patients. What is the dollar worth per every patient? What does it cost to get that patient? If we're a surgeon, what does every procedure cost? What does it cost to do the procedure? What is our staff cost per patient? Right? What is our staff costs per our total revenue? Do you benchmark what you're doing? All right?
Against best practice.
Yeah. All right. So what do you do when you achieve those goals? You've got to celebrate. Right? We used to have a little Friday lunchtime meeting, in the hallway, and we had the Mars Bar of the Week, where we celebrated either staff that had done something special and patients had given accolades for that, or we'd achieved certain goals. And I think it's really, really important to do that. The KPIs that we develop were difficult at the time when I started, because a lot of the practice software didn't print very many reports at all. And if they did, you had to take the data, put it into an Excel spreadsheet and calculate all of those things. Today, there's lots of systems that are automated, and we're even working now on a product that will be available in the next month or so, where we have a cloud-based product that hangs over the top of your software and will provide real-time all of these different things. What's happening with your revenue for the whole practice, for individual doctors or physios or what have you? What's your average waiting time? What are the percentages of the various item numbers that you charge? One of the things that I found was that doctors are so scared of being investigated by Medicare that half of the time they're not billing how they should do, and be able to provide them with information so that they can be confident and really comfortable with how to bill properly.
Can I just interject there for a moment? This notion of measuring the performance of your practice is extremely powerful. The amount of times that we have established practitioners coming to our courses, particularly, for example, the Practice Growth Strategies course, they'll come to the course, we'll ask the question, why are you here? What are you trying to get out of this event? And over and over we hear doctors say, I went to my accountant a few months ago and he told me that my revenue's down 30% on what it was the year before. And I'm just flabbergasted by the fact that it took a year for them to figure that out themselves. In fact, they didn't know. They weren't measuring along the way how their practice was performing. That's just one metric. Of course, there's many others. So The importance of dashboards, the importance of measurement, the importance of having metrics as part of your very regular reporting on the performance of the practice is extremely high.
Well, I'll give you one practice that I'm working with. We actually, and it's not just about the KPIs, there's the qualitative KPIs that we need to be looking at. And in this particular practice, within half an hour of the patient leaving the practice, they get an SMS to rate us, to rate the service they got from the admin staff and the support staff, and to rate the doctor. And we actually have a TV in the staff room with all the results of that going live in the TV. And look, it was a little confronting when we first started, but look, the exciting thing was that it really had people make change to the way they delivered and the way they worked. And so look, I can't speak more highly about measuring what you do. Try to do it in as efficient way as possible, and be prepared to tweak it when it's not doing the things that you want. I'm going to share with you a number of other practice efficiencies that you can use, and Ben's already alluded to this, like merchant facilities that integrate completely into your software, so that you're not having to do a bill in your practice software and then go over to your merchant facility and punch in the numbers, right? Some of these, like Tyro and Whitecoat, are integrating both the health fund rebates as well as Medicare. And I think that if we can have one machine that does that rather than two separate machines, really, really important. One other thing that I would say, Surgical Partners is another product that hangs over the top of your practice software, your merchant facility, and your accounting software, Xero or MYB, and real-time reconciles between every transaction that's happening. You can also program in what the doctors or the practitioners are paid. This is really saving time between your manager and your bookkeeper and allowing you time to do things to grow the business. The other thing that I have to deal with on a weekly basis is, sadly, fraud. And every one of you that owns a practice at some stage in your life will have to deal with fraud. And when you have these integrated systems, it eliminates a lot of the possibilities for fraud. But if it does happen, it shows it up a lot quicker and you're able to deal with it. So another reason for looking at that. Other cloud-based tools that I use for improving efficiencies are rostering tools that does pay and links with Xero MYB are things like Tanda and WageLock and Deputy, where, I would have some of my managers do the roster, but the roster was totally outside the budget that we actually had for the business. And if you can actually have a system so that you can do the roster and immediately see whether the roster's in budget or not, and then at the click of a button send the roster to the staff via SMS or email, what an amazing thing. And then at the end of the pay period, the roster, this product does the timesheets as well. The manager's able to look at it. The press of a button, again, it goes seamlessly to Xero or MYOB, and the staff are paid. So look, all of these integrated systems are going to help you, one, run your practice smoothly, buy back your time so that you can divide that time between growing your business more and having more time to yourself. And I suppose I just want to finish off with this slide and then hand back to Steve, and that is, in a business, we need real-time leadership. We really need on, are we the leader that we should be? Do we have the systems in place to make things far more functional and effective in our business? Are we spending time with our people to develop the culture that we need to get the outcomes that we want? And then do we have the structure that allows the business to function and the lines of communication to happen so that everybody is wanting to be in this workplace and all striving for the same thing? Thanks, everyone.
Thank you so much, Russell. Russell talks about leadership. Ladies and gentlemen, you've just heard, in my opinion, the greatest thought leader around medical business establishment and growth in this country. And that was just a snippet of what the kind of insights, strategies that are available to doctors, to practice principals to grow their practices and achieve the life that they want to achieve. I want to just quickly put a shameless plug in for our course program, where you will hear Russell speak more in greater depth, of course, through interactive workshop sessions around these notions, as well as many others. Those of you listening who are interested in establishing a practice, maybe an associate in one at the moment and looking to build their own practice, or wanting to implement some of these systems, policies, procedures, and these thoughts and strategies into an existing practice that is just starting out, then we have our Transition to Practice Comprehensive courses in Sydney in November, towards the middle of November, and in Melbourne at the end of November. The standard fee for attending this 3-day course is $2,145, but as a special deal negotiated by Medtech, we can offer you a place at these courses for $660. Just let us know in the feedback to this webinar if you'd like us to send you the special promotion code and link to the course page. For those of you in established practices who are looking to grow those practices, we have our Practice Growth Strategies course coming up in Melbourne, again at the end of November. This is a 2-day course where you will hear the kinds of ideas expanded on that Russell presented to today. Again, there is a standard fee of $1,595, but due to the very effective negotiating skills of the people at Medtech, that's been reduced to $660 for those listening in on this webinar today. So that's it from me. That's it from Russell. We hand back over to our webinar convener, Karen, to close us out today.
Thanks so much for that, Stephen and Russell, and for sharing your expertise with us and your generous webinar offer of attending those courses for a much far reduced rate. So that's really great. Now, Ben's going to answer some of the questions for us that have come through that are Ben related. If you have any other questions for Stephen or Russell or for Ben or for myself, please send them through now. We're focusing on your questions. So Ben, over to you.
Yeah. Thanks for that, Karen. The first question I've got from John: does your appointment facility send SMSs the day before asking and attending, or reminding the patient 2 hours before the appointment? Yes, it can. So you can actually set the reminders to be sent out when you like. You don't need to send them a day before if you don't like. You can send them an hour before or a few days before. So the system can be totally automated to send those messages out when you actually want them to go out. So hopefully that answers the question. Ruth has a question about, I have no doubt the online appointments are good for staff and patients. However, when I flagged this with my website and Genie software, my IT provider had some concerns about privacy and security. So they decided to not go forward. we've achieved the security barriers that you have, Ruth, by putting it into a secure portal. It's built on bank security, so with the online appointments, it's not going through a standardized website. It's a specially secure HTTPS website that the patient can do the appointments on. It's not saving the information that's presented on the website. It's feeding it straight into the practice management system in encryption, and then not saving it in the actual web cookies or any type of file on the website alone. Hopefully that answers the question. Janie Sturgis, sorry if I pronounced your name wrong. What Tyro integration can we use with Clinico systems? I'm sorry, Janie, but from my understanding, Clinico doesn't integrate at the moment with Tyro. We do, and there are a few other systems that integrate with Tyro. Clinico is a web-based application, and they haven't seemed to have done that integration yet. So sorry about that one. Vatat Patel, how do we get paid for video consultations with the patients? That one's pretty simple. With our telehealth solution, we have an e-commerce engine built into it where you can actually set the payment up before the consultation, where the patient will put in their credit card details, pay for the consult, and then once that payment is done, the consultation will either begin or you will wait for the okay on your end to say that the money has been transferred, and then you can start the consult. Okay, and I think that's about it for the questions. If anyone else has any other questions, let's have a look. Does your software integrate with QuickBooks, Leanne? Yes, it can. It uses surgical partners. It can integrate with that. You can also create templates using our report builder. So you can actually push out information to banking software and accounting software. The next question from Michelle, can MedTech online appointments take a deposit for appointments? Yes, same as the telehealth consult side. We have an e-commerce engine that's now built into the system where you can take payment before the actual appointment. So if you want to make the patients pay up front so then they get charged for a no-show fee, or you want to pay for the consult before they turn up, yes, you can do that. Ruth Bollard's also got a question. What Tyro integration with Genie? I'll have to check that. I think they do,
yes, it does.
But not off the top of my head. Yeah, well, there you go. Yeah, I was trying to remember that. Haven't been around a Genie customer for a while. And I think the last question, Christopher, are your previous webinars available? I think you asked that question earlier, and yes, they are available. Or Karen can give you more detail on that.
I'll just give you some detail on that, everyone. We've had a couple of requests for links to the previous webinars. I will add those to our follow-up email. You will receive an automated email 1 hour after today's webinar that will have links to both the presentations from today for those of you interested in those, and I'll also add the links to the previous 2 webinar recordings, so anyone that missed those can watch them. That was the answer to that. Also, on your way out as you exit, as Ben mentioned earlier, there will be a survey that we asked you to take the time to complete for us, because that helps us to build our sessions. So it asks you, if you have any suggestions for future topics, and we build these sessions around the feedback that we get from you, because we trust your feedback in that you know the types of information you need to learn about. So take the time to do that. Also, there are options if you'd like any more information from any of our speakers on that exit survey. Simply just tick the box and whoever you've requested to contact you will be in contact within the next 24 hours. Any other ones?
Yeah, we've got more questions. They're coming in thick and fast.
Do
telehealth consults provide Medicare rebate? There are some specific grounds that have to be met for telehealth consults at the moment. You can look it up on your MBS online portal. If you just type in telehealth on the MBS website, it can tell you about what conditions need to be met to do the Medicare rebates on telehealth. It's not mainstream at the moment, but it will be becoming more mainstream. Most of it's around private billings with telehealth. Next question.
Can I just make a comment there? At the moment, the Medicare rebates are predominantly for, you know, rural people or remote people needing access to specialist help and things like that. So quite a bit around mental health and also specialist support. But look, it will come, and you would be surprised at how many people are, if they can get an appointment to see a doctor and don't have to leave their house, how many will pay a non-rebatable fee?
Exactly. Like I said in my presentation, there was a site that literally does their first consultation, and then everything after that is mainly a telehealth consultation where they're paying full private fee. Okay, the next one, Michelle is asking, so what are the costs for your appointment fees? I can send that to you directly, Michelle. So we'll send that through to you, give you some pricing. It all depends on how many users that you want to set up on the appointments. Dr. David McDougall, you set up 26 practices. You want to export patient data. Yes, we do conversions from other practice management systems. So we can show you that, and I can have a discussion offline with you to show you other things like that. Jennifer, I'll have to get in touch with you on that one. Duda-based website, I'd have to check that for you. I haven't heard of that one, but I can get in touch with you on that one. And yeah, I can give you some pricing, Jennifer, in regards to our full application and our full suite of solutions. I think that's it for the questions.
Okay, thanks so much everyone for your time today. We appreciate you spending an hour out of your very busy day, and also to our guest speakers, Russell and Stephen. So that's all for today, and we look forward to seeing you at our next webinar, which will be in the next 4 to 6 weeks. Keep an eye out on our Facebook page for the date to be released, and we look forward to seeing you online soon. Thanks so much. Bye, everyone.
Thank you. Bye. Bye-bye.